Hey guys, welcome to another LitReview where I dumb down scientific journal article to my level. So in this video, the journal that we'll be reviewing is titled The Percutaneous Plantar Fascia Release with Needle, Anatomic Evaluation with Cadaveric Specimens. This was published in JFAS in 2018 by Dr. Catal et al. From Turkey. Now the focus of this cadaveric study is to evaluate a different surgical treatment for plantar fasciitis. Now, what is plantar fasciitis? I had it before. A lot of people have it before. It's a very common foot problem that happens in everyone. Mainly, the problem is the irritation of the plantar fascia or the plantar aponeurosis. And plantar fascia is a little band that basically starts from the plantarly, the median and lateral calcaneal tubercle, and extends to the five toes in our foot. And there is a medial, central, and lateral segments of it, and each segment is slightly different in their measurement in terms of thickness and width. Now, because of some underlying etiology, it could be activity, it could just be systemic, rheumatological, shoe gear, whatever it may be, or trauma, it causes an irritation in the plantar fascia, and that irritation ultimately causes that pain. Usually the first step in the morning. And usually, physicians will go on to treat this plantar fasciitis with conservative measures. And 90% of the patients generally get better with conservative treatment. Those treatment includes NSAID, physical therapy, stretching, change of shoe gear, change of activity, strapping, injections, and whatnot. But those 10% that do not get improved with conservative treatment, and usually they try for 6 months, the physician have to move on to provide their patient with some other alternative treatment, which is going to be a surgical option. Now, there's a whole bunch of surgical options that can basically alleviate plantar fasciitis, and generally it's to cut out part of the plantar fascia to basically alleviate the tension that's constantly causing the irritation. Now, in this study, Dr. Catal et al., they evaluated a different way to basically perform plantar fasciotomy. They use an 18 gauge needle, and they perform this on a 14 cadaveric foot cadavers. So what they did was first of all, they need a point of reference. So they drew a line from a point that is created by connecting median and lateral tubercle of the calcaneus and closer to the medial side 1/3. And from that point, they extended that point up to the inner space between the second and third toe. So having that line drawn, and then the other line, they drew a line that was aligned with the posterior aspect of the medial malleolus. So as you can see, I'll put up a picture here to see what I mean by that. So these lines were basically to tell the investigator where to cut. So they put a needle at the intersection point, and in order to cut using a hypodermic needle, 18 gauge, which is the whole point of this article, they inserted the needle about 45 degrees from the medial tubercle side a little bit towards the lateral tubercle, and basically used the bevel edge of the 18 gauge needle to cut the plantar fascia. And while they're doing this, they're obviously dorsiflexing the foot, the MPJ also, to basically tighten the fascia. And as soon as the fascia has been released and it felt the tension is gone, then they are done with the fasciotomy. Now, the advantage of this procedure is that it's relatively simple. You don't need to cut open any patient. You don't need any sutures. It's percutaneous. And based on the result, they were also relatively safe, and they did not create any complications like injuring the Baxter's nerve or the first branch of the lateral plantar nerve. So this is an interesting way to perform plantar fasciotomy, and it's a little bit crude in a way because you're not really looking at what you're cutting and you're just using a hypodermic needle to cut it. But this technique has been used in other fasciotomy or other cutting procedures. For example, when using a Ponseti technique, and when you're cutting the Achilles tendon of a baby, between the fourth and the fifth stage of the serial casting, they use a needle. And also oftentimes some physicians do flexor tenotomy for like hamatoral contractures or something in surgery, using also again the hypodermic needle. So I think the investigators of this article kind of got those inspiration and tried to see if they could perform a plantar fasciotomy using a hypodermic needle. And I think this was in Turkey, but in America healthcare system, I don't know if this is really a viable option. Patient might be a little bit wary, and also if this was possible, I mean, and people were accepting of this method, then this plantar fasciotomy could be performed in the office setting. So that's like a pretty cool thing if it were to happen. But this was like a clinical evidence level 5, so it's just more of an experimental, kind of more of a food for thought kind of thing. But I enjoyed it. It was relatively short, just for me to get back into podiatry after taking a couple of months break. I hope you guys enjoyed this video, and remember to subscribe and click that like button for me, and tune in for my next video. Thanks for watching.